Hi there. Good evening. I'm Ryan Davis, President of SPVS. Thank you very much for coming along to this evening's exciting webinar on the 10 laws everybody in veterinary practice should know about. And thank you very much to PetsApp for sponsoring tonight. It's going to be an interesting evening, I think. Our speaker graduated from Edinburgh Vet School in 1995 and worked in mixed practice before studying for an MBA at Nottingham Business School in 2001. He completed a master's in applied positive psychology, as well as general practice certificates in business, professional studies, and small animal medicine. He was the UK Pet Plan Vet of the Year in 2008 and is an associate professor in veterinary business at Nottingham University Vet School. In July 2020, he was awarded the title Fellow of the Royal College of Veterinary Surgeons in recognition of outstanding contributions to the veterinary profession. And in 2022, he was awarded the SPVS Inspiration Award. On top of this, he set up and developed 5 veterinary practices of his own as startups and currently leads and works as a clinician in Aldeburgh Vets in Suffolk. Alongside, he also co-founded Vetcentric Limited, which offers vets the opportunity to set up their own independently run practice via a joint venture model. On top of this, he founded Colourful CPD in 2017, which grew to become the largest distributor of non-clinical CPD in the UK. He sold Colourful CPD to Agilio Software in September 23, with whom he still works as a consultant. As if this wasn't a big enough bio, I haven't even mentioned the huge charitable adventures he's been on. 7 marathons in 7 days seems to be a highlight for me, but they might have to wait for another night. It's my great pleasure to introduce Brian Faulkner.
Thank you very much, Ryan, and hello everybody, and thank you for joining us. And if you're seeing us on playback, well, hello to you too. Okay, well, thank you very much, Ryan, and thank you everyone for joining us. And if you're watching us on playback, well, welcome too. So this is a relatively sort of dry subject area for me. I tend to enjoy more juicy, sort of psychological, human-related things than perhaps something as dry as 10 laws. In fact, we're going to talk about more than 10 laws, but 10 laws is core 10 laws, and it's not going to be a list of laws. I'm going to try and make it very practical. And the reason why I'm talking about this is when I'm helping people set up veterinary practices from beginning, if they're not familiar with the veterinary profession, and even if they are familiar with the veterinary profession, sometimes there's an uncertainty about what regulations they need to be aware of and how that relates to what potential innovations they're thinking about with their new veterinary practice. Or if you're a manager who perhaps is brand new to the veterinary profession and you're trying to work out why we vets do certain things in certain ways and why we don't seem to do things that some of them would perceive as a more obvious or perhaps an easier way to do it, and why there's certain restrictions. So that's really the relevance of why I've set this up. So I'm speaking on behalf of Colourful CPD, who's now part of the Agilio group, which, as Ryan said, was acquired during September of this year. And as part of that, we sell online CPD. And a lot of what I'm going to talk through here is particularly within our non-clinical skills certificate in veterinary practice management. We've got one for the UK regulation, and we also happen to have one customized for Irish regulation as well. If you're interested, currently we're doing a 20% off all courses and qualifications until the end of the calendar year, to the December 31st, 2023. And to claim that at checkout, you just use the code BFCCPD20, and that'll activate the 20% discount on any of our courses and qualifications, not just our non-clinical skills certificate in veterinary practice management. We do a range of vet reception and nurse training courses as well as qualifications and non-clinical skills certificates. So to orientate this talk, I want to start with a slide that I use at the beginning of every one of my talks, is that I help veterinary practices proactively pursue 4 outcomes by the 4 rules in practice. So what does that mean? Ultimately, the 4 rules in practices are the vets, the nurses, the CCA, so client care associates, so reception and oral language, and the management team, those that own or manage or run the veterinary practice. Now, of course, one person may be more than one of those roles. You may be a manager who's also a vet who does the clinical work as well, or an owner who's a vet. And the 4 outcomes are good clinical, good client, good financial, and good team or colleague outcomes. So just quickly defining those. Clinical resolution, of course, is about preventing and resolving disease. And that's technically difficult enough to do, but we have to do it in a way where the clients who own our patients, we can't just tinker with patients because we think we want to or it's the right thing to do. We have to get permission from clients who won't give us consent or comply with our recommendations unless they feel satisfied. And the emotion of satisfaction is when they perceive that it's the right thing for them and their pet, and that what we're going to charge them, they perceive as a fair price. In fact, one of the biggest challenges in veterinary service is those words right and fair are subjective. You can do the same consultation or interaction with 3 different people. Somebody thinks it's wonderful, somebody thinks it's okay, and another person actually even complains about it, and including the price. Because veterinary is a privately funded and financed profession, ultimately we have to think about money. There's 3 elements to the financial element of veterinary practice. There's the prices and therefore our price list, the pro forma estimates and invoices, and then payment. And we could spend a whole day talking about how each of those deliver different perceptions of value to the client. And then we have to make sure that we do it in a way that we as a team feel safe, confident, and motivated, despite the inevitable challenges in veterinary practice. When you upscale this to the core themes within any business organization, we can equate the clinical operations to the business operations process. Ultimately, client satisfaction is delivered by marketing. We've got the accounts and finance side, and we've got the human resource side. And these are the core themes that if you do an MBA or any management course, these are the themes that ultimately track back to the operational outcomes of these.
Sorry to interrupt. Can I please just ask one small favour? Once you've completed this session, head over to petsap.com and book your catch-up call with a member of the pack today. Most of you watching this session will go on to utilise our other CPD and CE credited resources in our learning library, and that is fantastic. But less than 50% of you will go on to actively join our community. And it's a two-way street. The more we can grow our community, the more speakers we can bring in and the greater the resources we can create for you for free. So head over to petsap.com today and find out how we can help you to better support your teams and the pets they serve. Thank you.
So let's make this a little bit more specific and operational. Here we have our veterinary practice. We've got the pet owning public or animal owning public on the left-hand side. And hopefully by the time they go through the veterinary journey, we've moved their patient or our patient, their pet predicament along to clinical resolution in a way they're satisfied with. And we get the bill paid and everyone's felt happy doing it. So I'm going to use this clinical client journey as a template on which we're going to build and apply these laws. So I refer to the clinical client journey across 3 stages. We've got the preclinical contact, the clinical contact, and the post-clinical contact. So preclinical contact starts with first contact we ever have with the client, or maybe the first contact in this illness sequence, and that can be, of course, by telephone, app, email, whatever way they contact us. If they're not registered, we'll aim to do that, triage their pet's need, schedule the appointment accordingly, and then they turn up for that appointment. They go into the veterinary consultation. A certain proportion of patients will be admitted for some sort of inpatient procedure, maybe not directly in that particular day, some of them yes, but others may be scheduled for a diagnostic or therapeutic or neutering procedure in due course. Both outpatients and inpatients generate invoices. They make their way back to reception. Reception asks for payment. And that is ultimately the business journey, transfer of money from a client's bank account to the business's bank account. Now, some don't happen directly. It's more of an indirect payment. And that can occur, for example, with a direct insurance claim or a healthcare plan. And then crucially, at the end of every clinical client journey, unless we euthanize a patient, we'll always be thinking, when will I see you again? When's that next contact? So, for example, the annual booster vaccination, if the patient's now well. So there's the clinical client journey in relation to what we're doing. And we build around that, if you like. If you want, that's the game that's happening on the football pitch. But we have to think about the things that happen around that. So once money goes into the bank account, there's inevitably certain costs that come out of it. Cost of sales, the cost of employing the veterinary team, the cost of employing the non-veterinary team, the cost of running the business, so in terms of the overhead, and hopefully after that there's still some profit, which we refer to as net profit. And that's tracked using the profit and loss sheet and in relation to the management of the money side of the business. So that's kind of the core operational side. And we think about what goes on around that. We've got the personnel, the people, in terms of the HR, recruiting, retaining, learning, development of these people. We've got the premises in which all of this occurs, and we've got the equipment that we need to do this. So we have to add facilities and equipment management in here as well. And then the final layer is the organization in which all of this occurs. So the big picture in terms of the statutory or responsibility and obligations, as well as the people who own the business, so the executives, in terms of what their strategic plan is. So this is, if you like, the business owners or management's job description in one slide. These various layers in relation to the outcomes or responsibilities that we're trying to achieve. So what I'm going to do during this talk is look at how these various layers relate to many of the regulations in which we have to operate this game within, if you want. So the first thing I'm going to focus on just in passing is first, before we do that, I'm going to look at the various terminologies of what we refer to as acts, regulations, and guidance. So beginning with acts, acts are statutory legislation that are passed by Parliament, and they ultimately become the laws of the land, which all people must comply with in relation to if it affects them. And then regulations are how acts are actually applied. So it gives much more detail about how a certain act or law is actually implemented. So there might be much more specifics about what you must do and what you mustn't do. Acts tend to be bigger picture regulation. And then sometimes you have more guidance from codes of practice rather than necessarily specifically laws. So take, for example, ACAS in relation to disciplinary and grievance of people. That's not actually a law in relating to employees, but it's considered the guidance, the code that you have to follow. Even the Royal College's Code of Professional Conduct. Yes, it's the application of the Veterinary Surgeons Act 1966, but a lot of it is not specifically law, but it's how the Royal College has interpreted or applied some of that. So let's begin with looking at the actual premises and equipment, some of the things that we have to be aware of when we're actually running or even setting up a veterinary practice. So the first one is planning permission. Just so you know, ultimately, as you're aware, every business needs to have the appropriate level of planning permission or use category for whatever type of business it is. Veterinary practice is under Class E. This is relatively recent amendments in 2020 regulations. It used to be different classification, and actually it's made it much easier for premises to become used as a veterinary practice. But ultimately, you need to apply for change of use if you want to set up a business. And when you set up your veterinary practices must be registered with the Royal College of Veterinary Surgeons in order for the veterinary surgeons to supply medicines. That's actually the main legal requirement why they need to be registered with the Royal College. It's actually to do with the supply of medicines. So the registered premises are inspected by the Veterinary Medicines Directorate, which is a government department, and often this happens via the Royal College through the Practice Standard Scheme. But ultimately, it's the government department, the Veterinary Medicines Directorate, that's responsible for the supply and sale and regulation of medicines, and that's actually how the Royal College becomes involved in that. And we'll see later that the Royal College doesn't regulate the veterinary business. It only regulates the registered members, so MRCVSs, the vets, and the registered veterinary nurses. Currently, the Veterinary Surgeons Act 1966 has no powers over the business. It only has powers over the individuals. But the only relevance the Royal College has in relation to the business is to do with because the fact that the business is supplying veterinary medicines. And the Royal College holds the register of veterinary practices on behalf of the Veterinary Medicines Directorate. So yes, there are a list of all the practices in the UK, and the Royal College does that, even though, of course, it only regulates the individual nurses and vets within that. And there's an annual fee for registration of a veterinary practice premises, and you have to pay it before the April the 1st each year. Then looking on to the fact that if you've got premises, well, we need to think about what business insurances we must have, and also we might have to have as optional. So the Employers' Liability Act 1969 says that you must have employers' liability insurance, and this is so that we protect any of our employees in case they get injured or become ill as a result of work within our business. So it's a legal requirement that we have that employer's liability insurance. We also will often take out public liability insurance. In fact, they often come with employer's liability policies, but actually this isn't mandatory under UK law. You don't have to have public liability, but it makes good sense to have it. So what you're ultimately doing is protecting the business against any legal claim or action potentially for injury or compensation from non-employees, as well as potentially if your business happens to damage someone else's property. So classic non-employees, members of the public, clients, suppliers, even just people passing by and something falls on their head. So public liability isn't technically mandatory, but it's often included within your employer's liability policy. And then professional indemnity. So it's not a mandatory law within the UK, but the Royal College Code of Conduct states that it's something that we must have to be considered a valid member of the Royal College of Veterinary Surgeons. And you can see it's highlighted here. Ultimately, we have to have some form of professional indemnity insurance to practice as veterinary surgeons. And of course, the Veterinary Defence Society is the prominent brand for that. And then for having buildings, ultimately, we have to have fire safety. This is regulated under the Regulatory Reform Fire Safety Order 2005, the RRO. There are different regulations in relation to Scotland, Wales, and Northern Ireland. Let's just use the English one as an example. They're pretty much all the same, they're just slightly different terminology. And this means that we all have to take a fire risk assessment for our premises. We have to have certain firefighting equipment, it's mandatory. We have to have certain signage to direct people in terms of the use of that equipment and how to escape should there be a fire. And we have to do mandatory training in relation to preparing in case there is a fire. So some of these things that we have to do, and including the log to prove that we've actually had this training. So that's the idea here I'm thinking about, is the level of the premises and the equipment. If you're just going to have a shell of a business, the things and the regulations you need to be aware of just even to have a building in which human beings engage with. So then within that building, we've got our team and our colleagues, and let's look at some of the legislation that relates to employment. So when we're employing staff, the big act is the 1996 Employment Rights Act, and that gives employees, there's been various iterations of this previous to 1996, but this is the most recent version, and ultimately it gives employees statutory rights. And it means that employees, there's certain what's called written statement of particulars before they are employed. We have to comply through this regulation with the national minimum wage in relation to the age of the employee, and they have to have a contract of employment within 2 months of starting. Of course, it's good practice to have that contract the day they start, if not even before they start. And these are some of the things that has to be specified within that contract. And these are legal obligations, what their title is, what their hours, what their wage, what their holiday entitlement is, where they sit in relation to pensions, minimum notice periods, what your disciplinary procedure is, which could be referred to within your employee handbook, and then the process of reporting a grievance. So if they feel they have the right and that they're entitled to report a grievance if they're feeling that they're being aggrieved in somehow. And then this act also made it clearer in relation to the process and some of the considerations to protect employees against unfair dismissal. So I'm just going to take a little look at that, because that's probably one of the biggest concerns that new managers have, I find, in relation to managing colleagues, especially when colleagues don't do what the manager hopes or expects them to do. And if you have, for example, a disciplinary, the thought that you ultimately need to discipline an employee, and of course you can think about behavior where you've got minor, miscordons, you can have misconduct, and then you can have gross misconduct. So just paralleling those thoughts, if you're familiar with our code of conduct as vet, we can talk about gross professional misconduct, and that's in relation to our behavior as veterinary surgeons in relation to the Royal College's code. Whereas more general employment, we talk about gross misconduct, and that's something that's considered a major breach of trust between the employer and the employee. So theft and violence to someone else, turning up drunk, something that makes you significantly compromised in terms of the trust contract between an employer and an employee. So should you perceive that you have cause to discipline someone, you have to follow the ACAS code of disciplinary and grievance procedures, especially if you think that that disciplinary may end up in a dismissal, because of course employees have the right to claim unfair dismissal, which we'll look at in a moment in relation to how that disciplinary could be carried out. So I'm going to do this little flow diagram because I find that there's a lot of confusion and concern about how you go about operating within the law in relation to having a disciplinary procedure. So let's say on the left-hand side, we've got concern about a colleague's conduct or their performance. And ultimately, that's really the two sides to the employment trust: your conduct and your performance. Are you doing the job? And conduct's your behavior around your professional behavior. So let's say you end up with potentially the outcome whereby the employment of a colleague is terminated. And if you do terminate and then a colleague's or an employee's employment, ultimately you want it to be liability free. You don't want to make yourself vulnerable to a tribunal. So we'll compare it here to the tribunal, whereby they take you ultimately to court if you want and claim that you have terminated their employment unfairly. And there's really two ways in which we can think about how this can happen. Ultimately, if an employee has less or fewer than 2 years service in relation from when they were employed to when you terminate them, they're actually relatively unprotected. They're always protected, which we'll look at in a moment, for any suggestion of discrimination against certain protected characteristics. But if you basically decide that their performance is not up to it within the first 2 years of their employment, you pretty much have relatively free rein to which to say, I'm sorry, this is not working out, and away we go. It's better to do it, shall we say, in a reputational through probation and various checking in relation to their performance on a scheduled matter, rather than just doing it out of the blue. Although technically, you can tap someone on the shoulder and say, I'm sorry, this is not working out. But of course, you have to fulfill your contractual obligations of any notice periods if they decide to leave in that moment. But ultimately, an employee has much fewer protections within the first 2 years. And if they do feel that they've got a case, they must raise their case within 3 months, less 1 day. Not sure why it's less 1 day, but that's what the law says. 3 months, less 1 day. In other words, if they don't raise a concern or a grievance or some sort of appeal in relation to terminating their employment, you're home free. That's that. Okay, unless, of course, there's potential discrimination. So let's look at the ACAS Code of Conduct, Code of Practice in relation to how disciplinary procedures should go down. Ultimately, you're going through here the formal disciplinary procedure. And what you do, if you have concern about someone's conduct or performance, you invite them to a disciplinary meeting and you outline, if you want, the charges. That might be quite a strong word, but imagine it's like an arrest, but you're outlining the charges against them, what the concerns are. Please, can you attend a disciplinary meeting in 3 days' time at 10 a.m. at this particular time, and it's concerning your behavior, let's say last Tuesday in relation to your colleague, whatever it might be. You outline what it is. Then you have the disciplinary meeting. You basically say, these are our concerns. So one of the important things, especially if you're unfamiliar with disciplinaries aren't a scolding, if you like. They're kind of like a mini court. What you're trying to do is investigate. You may have done some pre-disciplinary meetings, investigations to see that the allegations are at least valid. But what you're trying to do is basically say, well, okay, give me your side of the story. This is our side of the story. That's really what you're actually doing in that disciplinary meeting, listening and giving at least some sense of defense, opportunity to defend. And what you'll say is, when you say to the employee, okay, this is what we perceive you did. If you like, they've got the option to plead guilty or not guilty. They can either say, yeah, okay, fair enough, that's true, that's what I did. Or no, I didn't do that. That's a distortion of what actually happened, or that's all false. So you have your disciplinary meeting, and ultimately you have to make a decision. And you may say, well, no action needs to be taken here. There's no hard finding of evidence that this person has either done any form of misconduct, never mind gross misconduct, so you take no action. That's that. You can maybe give them a first formal warning as a result of the investigation and the procedure. You can maybe even give them a final warning, so you can have a first and final warning, or maybe this is perhaps the second or third event, but you're now saying this is the final warning, or you potentially could dismiss them. And it could be dismissal straight off, or it could be actually you had your final warning and actually now it's gone to dismissal. So dismissal whereby the employment terminates. But remember, not all disciplinaries mean that it's about dismissal or not, but dismissal is one of the outcomes that can happen. And if you terminate someone's employment, ultimately they've got 3 months less 1 day in which to decide whether they think they've got a case, i.e. the worst scenario can happen is they take you to tribunal, but before that, they normally will appeal. Rather than just going straight to tribunal, tribunals aren't interested in just hearing petty squabbles. So actually they say, well, you've got to have an appeals process. So you do an appeal, and ideally it's heard by someone other than the original person who did the disciplinary, and they will make a decision. So maybe they overturn it. Somebody who was dismissed, they actually say no action is needed whatsoever. Or maybe they'll say, actually, rather than dismissing this employee, we just need a warning here. But let's say it ends up with upholding the dismissal, and then the employee still feels aggrieved. So they've got the right to submit to a tribunal for an unfair dismissal claim. But ultimately, for them to prove that they've been unfairly dismissed, they have to prove that they've been dismissed for an unfair reason, or that the process was unfair. And that's really important. You can't just say, you can't just be judge and jury by yourself. Even if you've found somebody who's relatively strong, let's say gross misconduct in relation to employee, you have to go through a process of at least being seen to investigate it. And I don't mean seen in some sort of charade way, but actually go through the process of investigating it, giving someone the opportunity in which to explain it. And what you'll find is if somebody strongly evidence, shall we say, of gross misconduct that's almost certainly going to lead to a dismissal, almost certainly very frequently they resign at the invitation to have come to attend the disciplinary. That's often what happens, but it doesn't always happen. But also people can claim that they've been dismissed for an automatically unfair reason. Okay, and we'll look at that. So in other words, that applies at any time, not within just the two, not in other words, just because they're within 2 years, as I alluded to earlier, there's certain things you can never dismiss people for. And you'll have a fair idea what they are in relation to the Dismissal and Discriminatory Act. They call these Act 2010. We'll look at them in a wee moment. Okay. So, but ultimately, for someone to stand a chance of winning a tribunal against an employer for an unfair dismissal, it's either going to have to be they show that the reason was unfair, the process was unfair, or they've been discriminated against. Sometimes we think that when employees resign, oh, that's great, they've resigned, that troublesome person that we wanted to get rid of, and therefore it's over. Not necessarily. Sometimes people resign and they claim constructive dismissal. And constructive dismissal occurs when people say, well, you made my experience in employment so impossible in relation to the terms of my contract that I had no choice but to resign. Usually before they do that, they should file a grievance to actually say, actually, yeah, just so you know, actually, I think you're breaching your contract, employer. You said that I was going to, for example, work in this location, but you constantly send me to that location, and that's difficult for me to get to. And that's not what it says in my contract, or you're asking me to do different hours, or whatever it might be. And then they should express a grievance. The employer should listen to that grievance and decide whether they have a, shall we say, a case, and then respond to it. But if they don't, and the person then resigns, they potentially can take you to a tribunal for claims of constructive dismissal. There is another way to say goodbye to employees rather than go through the ACAS code of practice. And it's basically, shall we say, off the record conversations. And they're quite an interesting tool or mechanism for saying goodbye to employees. They're not without the risk, though, but they potentially can avoid certain pitfalls of the getting stuck into the disciplinary procedure. There's two mechanisms, one of them which is called a protected conversation. And you can basically tap any employee in the shoulder and just say, you know, I want to have a word off the record. This is an off the record conversation. Neither of us can talk about this at a tribunal. If they agree to having a protected conversation, you don't have to agree to having it, but if they agree, and it might be in the nicest way, you're leaving, but let's just talk about the terms in which you're leaving. The thing about a protected conversation is you don't actually have to have a dispute going on in relation. There doesn't have to be any evidence of a grievance either way between the employer and the employee or vice versa. So that's quite rare, to be honest, in veterinary practice. But one that is relatively common is a mechanism called where you have a without prejudice conversation. So this is an off-the-record conversation. You can invite the party with which you have a dispute to say, do you want to have an honest, frank conversation about certain things off the record, meaning I can say certain things that actually you can't bring up in tribunal. And it might even be, I offer you a settlement of an amount of money, but this is off the record and you must not talk about it if we end up in tribunal. Okay, and potentially this can be that you agree to terminate the employment, and assuming they sign it without prejudice in the terms that you've agreed, well, then you're home liability free. What you can't do, of course, is ever have a protected conversation or a without prejudice conversation about something that's considered blatant discrimination. You can't say, do you want to talk off the record about why I'm saying goodbye to you because you're pregnant? And that would always be against the law. That's never protected. But if you're in relation to, do you want to have a conversation about perhaps I have concerns about your performance? I don't want to go down a disciplinary way, but I want to come to an agreement, usually a financial amount of money, whereby we agree to part ways. And this is effectively what I presume happens when football managers get sacked. Okay, you can have it without prejudice conversation at any stage. You may have already gone through the disciplinary procedure and said goodbye to the employee, but actually then they raise an appeal or a grievance in relation to threatening to take you to a tribunal. And then you can say, well, actually, rather than fight about this at tribunal, do you want to have a without prejudice conversation, which basically means it's an off-the-record conversation and what we say. But one of the things about the without prejudice conversation is it has to be seen to be a genuine attempt to try and resolve the problem. You can't just send emails slagging each other off and saying, well, you can't quote this. It has to be genuinely to try and resolve the issue. So I think it's quite useful to understand the difference between the code of conduct disciplinary formal way and also the off the record way. And I can tell you I've used both in my experience of nearly 30 years. So let's come back to some other employment. So the anti-discrimination laws is the Equalities Act 2010. There's 9 very specific protected characteristics, and you would know what most of them are. They're things that you're familiar with. So when people claim discrimination, they can't claim discrimination because you say, well, for example, you don't like me because I'm a Liverpool Football Club supporter, and therefore that's discrimination. Well, unless you can prove that Liverpool Football Club supporter connects to some sort of these particular characteristics, actually that's not a discriminatory thing. There's very specific discriminations that the law says you can never disadvantage an employee as a result of these things. And then, of course, if we employ colleagues, we have to abide by the health and safety. The big current legislation is the Health and Safety Work Act 1974, and this pretty much says that we have to do certain things. It's been updated by the Safety Information Regulations 1989, and ultimately this is why we have to display the health and safety poster, and this states what employers must do in relation to health and safety, what employees must do to remain safe. So it's not about being reckless as an employee and therefore blaming your employer for all harm you sustain, and what they do if there's a problem or concern about someone's safety, and who their health and safety representative is that they go to voice a concern. So this is a legal requirement that all companies must do. And then there's what's referred to as the 6-pack regulation. So this is a bunch of regulations that helps apply this Work Act 1974. Don't get worried about the detail of all the names of these, but ultimately these are things you'll kind of be familiar with in an operational employee way. But if you are kind of being purist in going through how this relates, so let's look at the management of health and safety at work regulations. But ultimately, this is the regulation that says you must perform a risk assessment. And according to Health and Safety Executive, this must be a suitable and sufficient risk assessment. So this means that we properly check risks. We decide who might be affected by this particular health and safety concern. We identify any significant risks, and we take reasonable precautions to therefore make sure that the risk, if any, remains low. And then the workers or the representatives, they say a union, are also involved in the assessment process. It's not just the employee saying, oh, well, that's what we think's fine. You actually have to have consultation with the employees to go, are you happy with that? Does that sound like a reasonable level of safety? Then the power regulations, ultimately, this is about equipment. So we just have to make sure that equipment at work is suitable for its intended use, it's safe, and it's maintained as safe. Therefore, we have regular inspections and services to ensure that it remains safe. And also those who are using certain equipment, especially if there's a risk of harm of using that equipment, that they've got information, instructions, and training, and also that there's any associated safety measures or taking maybe a protective device, a guard, for example, around a machine that could harm us, maybe markings in relation to do not cross this line, and any warnings about that harm that might occur if you engage with that machine. So common sense often stuff, but it just needs to be specified. And this is particularly relevant, of course, if an accident happens in relation to having a particular piece of equipment. Because while certain checks and services are not specifically law, but if things go wrong, you're going to be on the back foot if there's an investigation from the health and safety executive. Manual handling, of course, ultimately, you have to not harm people if they're lifting heavy weights. So the principles of manual handling is, we'll avoid it if practical, okay? Assess the risk if you can't avoid actually handling that thing, and then reduce the risk to be as low as possible if actually you can't avoid it. So therefore, there's various rules and systems that actually have to be in place to make sure that you use any equipment for manual handling. People need to cooperate, and also to make sure that their handling doesn't put people under risk. Putting that in relation to more specific guidance, this is a diagram within the Handling Operations 1992, and it shows you in relation to the recommended levels of lift in relation to where your arms are. You can see the blue is down by your side, and you can see if you bend your elbows in the green, whereas if you're holding something out. And I always remember being told, and I didn't really understand for a long time why, but I was always remembered told that we shouldn't lift more than 16 kilograms. So you can see on the female there, that basically there's 16 kilograms at arm's length. And so that's kind of a general rule of thumb, is if a dog, for example, is more than 16 kilograms, we should have 2 colleagues taking an end each of that dog with a view to lifting it onto the table. I think it's quite, it doesn't mean you're not allowed to lift more than that, because we know at times people do, but this is considered a wise guideline for the amount of weights that we should lift. And then we've got all of this workplace health and safety regulations, and this is all about in relation to the premises. And again, it's common sense. I mean, all of these particular regulations are listed within it, but it's a useful little list, and I'm not going to go through them all, for all of the common sense things that you need to check in relation to premises at work. And then we've got personal protective equipment regulations 1992, and therefore the idea of the principle with any health and safety thing is always avoid the risk of something as your preferred tactic. But if for any reason you can't avoid coming in contact with something that could be considered dangerous, well, you must provide personal protection equipment, and it must be adequate, and people must be trained to know what to use and how to use it, and the PPE must be maintained and also stored properly. In veterinary, what sort of things have we got? Well, of course, one of our biggest risks is actually being bitten by dogs, so we must have access to muzzles and safety, things like that. We'll look at the ionizing radiation in a moment in relation to having lead protection for radiation. And of course, likes of chemotoxic substances that we engage with, we must make sure that we are protected with gloves and gowns and goggles and all of those things that we might have in relation to handling those types of drugs. And then we've got health and safety in terms of relation to screen displays, 1992. And this recognizes that ultimately working on workstations continuously and repeatedly can cause tiredness or RSI, as well as eye strain. So employers must carry out a risk assessment of workstations to make sure that actually the posture is correct and the distances are correct, and that there's anything we can do reasonably to make sure people don't suffer as a result. We also must ensure that employees take regular and adequate breaks, and actually employees are entitled to ask employers to pay for an annual eye test to check that they're not deteriorating as a result of prolonged use of screens. And also we must take health and safety training to demonstrate to people if they are using screens and how their posture is in relation to that. So these are just going through some of the specifics of what's called the six-pack in relation to the application of the Health and Safety Act 1974. The other big health and safety area, of course, is COSH, and COSH stands for Control of Substances That Are Hazard to Health, 2002. And ultimately, if we've got certain substances that are hazardous to our health, our human health, and even animal health, we must do something to prevent exposure to them. So we have to go through ultimately every single substances in the building, identify whether it's potentially hazardous to our skin, to our eyes, to whatever, assess the risk or the extent of that hazard, and then install or take reasonable measures to reduce harm of exposure to that and maintain those systems, and therefore inform, instruct, and train employees about things that could harm them that they may be oblivious about. So ultimately, the way to do this is go through every single one, but we identify the most hazardous substances at our practice, and we'll fill in one of these sheets. So here's an example of doxorubicin, so a cytotoxic drug, so by design, designed to actually kill cells. And of course, doxorubicin is used for chemotherapy, and you can fill in for every single one of the items and substances, not just medicines, of course, but cleaning materials and all sorts of any substance that we could come in contact with. Where is it stored? What's the severity of the risk? What's the likelihood? Yeah, it's possible, of course, that we could harm ourselves, but probability is quite low, especially if we take the necessary precautions. So who's at risk? Well, staff who are using these drugs, owners perhaps whose pets have administered it, and it could be expelled in body fluids. Who must avoid this? So pregnant staff would avoid cytotoxic drugs, possibly, probably, well, definitely people who are immunocompromised. And then what controls measures is the practice taken? Well, there's a leaflet for clients about how to remain safe if their pets are receiving this drug. What must they wear? Gloves, mask, any particular first aid. For example, antidote, or things they mustn't use to wash it off, or things they must use to wash it off. For example, nothing specific in this example. If there is spillage of this substance, so because cytotoxic has to be handled by the purple lidded waste container, that's relevant. And who made this protocol? When was it done, and when must it be revised? So just a simple little card system that you can do for every substance in the room. And that's quite a difficult exercise when you actually go through almost every substance. We're so sort of blind, if you like, to substances we use every single day that we don't consider hazardous. And often most of them aren't, but some of them we have to think actually. And that includes every single drug in your pharmacy. And then we've got the first aid regulations. So ultimately, because accidents happen, first aid provision is deemed it must be adequate and appropriate. That's the legal jargon. So ultimately, employers must assess the need and therefore provide sufficient first aid in terms of a kit, or what facilities and personnel with training they must have. And the health and safety executive describes ultimately 4 layers of first aid competence. And they've got the appointed person, first aid at work, and the first level 1, level 2, sorry, and level 3. And then in some contexts, you actually need particular additional training. So veterinary practices are considered a high-risk environment. So because we use scalpel blades and there's the potential to harm ourselves significantly is there compared to low risk environments, maybe something like a teacher environment or something like that. And without going through the specific details, ultimately the risk isn't black or white. We have to assess in relation to the number of employees that we have and how many first aiders and what level of training they have to be exposed to. Is it a level 2 or is it a level 3? In terms of sales and marketing, just going to look at some of the regulations and when we're engaging with clients and some of the things we need to consider. So when we're at this first contact, we have to think about advertising ethically and legally. And sorry, that was just showing that the Royal College has certain, in section 23 of its code of conduct, there's certain claims that we can't make. For example, we can't call someone a specialist, because a specialist is a protected title for the Royal College. You have to have certain qualifications and do certain things. So in relation to what we're allowed to advertise, so section 23 covers that. GDPR, of course, is the more general one. So ultimately, when we are registering clients at first contact, we're ultimately become processors of personal data. And processing of personal data refers to almost anything you do with someone's personal data or information. So collecting it, recording it, storing it, using it, analyzing it, combining it with other pieces of information, disclosing it to anybody, or even deleting it has to be done in appropriate ways. So the GDPR regulations 2018 specifies how we do that. You have to register with the ICO, so the Information Commissioner's Office, so and you pay your annual fee for the very fact that you're collecting the personal data, as we do. Okay, and you have to appoint someone who's responsible for complying with data protection regulations. Then in relation to registering clients, so some of our colourful courses talk about the principles, of booking appointments and scheduling them, not law, should be, of course. And then in relation to advertising medicines, advertising generally, I just wanted to point out in particular that we're not allowed to advertise POM, so prescription-only medicines. You're not allowed to advertise them unless to people who are qualified to prescribe those PMVs, and that's why non-vets and non-nurses technically shouldn't even receive the likes of the Veterinary Times, because they advertise prescription-only medicines as a trade journal. And that's one of the reasons why not everyone can actually get that publication. But that also means that we're not allowed to show medicines on display that a client can say, oh, that's the medicine I want some of that, because prescription-only medicines are just that. The use of them must be decided by the practitioner who's using them at discretionary to treat an animal. Let's look at some of the clinical operations. Well, the big one, of course, getting to the actual technicalities of veterinary, is regulated and governed by the Veterinary Surgeons Act 66. And the big part of this legislation is it basically says that only a vet has the right to perform certain acts of veterinary surgery. And that word surgery, we tend to assume is sort of surgical as in operations. But in the eyes of the law, acts of veterinary surgery are defined in relation to 4 things. So an act of veterinary surgery is only a veterinary surgeon has the right to diagnose or pronounce a diagnosis of a disease and then perform certain diagnostic tests. Okay? Only a veterinary surgeon has the right to give advice upon the presumption or the confirmation of a diagnosis. So do this, don't do that, or including the prescription of POM medicines, in particular POMV medicines. That's one of the categories of veterinary medicine. We'll see in a moment that there's 4 categories, and the POMV means that the only people who can prescribe that medicine are veterinary surgeons. So therefore it's an act of veterinary surgery. And then there is what we would call surgery, the performance of surgical operations on animals, but certainly and particularly those involving going into a body cavity. And actually, if you ask anyone what's the difference between a vet and a non-vet, these are the 4 differences. Only vets can diagnose or perform a test with a view to diagnosing, give advice on a diagnosis, prescribe POMV medications, or operate on an animal. And that's what makes vets and vets. And they can only do so to animals that are under their care. And I'm sure you're familiar with the Royal College has had a big consultation and review of this with lots of confusion. But remember, under our care isn't just about prescribing, which seemed to cause a lot of confusion on the under our care consultation. It's not just about prescribing medicines and how much you need to see the animal for that. It's whether you're even advising a client to do something for an animal under your care, even if medicine isn't involved. Okay. So I want to show how the Veterinary Surgeons Act and how it relates to Schedule 3 exemptions. So Schedule 3 exemption seems to confuse a lot of people. So it's ultimately certain situations and certain people are exempt from having to comply in relation to the acts of veterinary surgery. In other words, certain people can perform acts of veterinary surgery even though they aren't a veterinary surgeon. So let me just show you how that pans out. So here's veterinary surgeons, and you've got this group, if you like, within this little Venn diagram of lay people, so non-qualified, non-regulated roles. They can perform minor medical, non-surgical procedures. So for example, that's why pet owners can inject their dog or diabetic cat with injections. They're allowed to do that at home without supervision. There's very minor things they're allowed to do. And then show you in relation to veterinary nurses. So veterinary nurses who, and there's specific wording about this, but they're under the employment of a veterinary surgeon and they're directed by the veterinary surgeon, have got certain exemptions. So they're allowed to perform certain acts of veterinary surgery under the direction or employment of a veterinary surgeon. And there isn't a specific list of Schedule 3 exemptions, but you'll be familiar with what sort of things. They can give intravenous injections or take a blood sample, or they can do various bits and pieces as long as they're working in conjunction and direction of a veterinary surgeon. So that's, if you like, the difference between a veterinary nurse and another normal lay person. So in other words, a veterinary nurse has got certain powers because of the fact that they're veterinary nurses in relation to the Schedule 3 exemptions within the Veterinary Surgeons Act. And then the other big operational one is the veterinary medicines regulations, and that is often used in relation to the misuse of drug regulations 2001, and that's all about the supply, the acquisition, the supply, and the prescribing of drugs. And when you think about medicines or drugs, they're ultimately, if you like, into two categories: non-controlled medications and controlled medications. So controlled medications are those that have the potential for abuse. So therefore, they've got an extra level of legislation around them, as specified by the Misuse of Drugs Regulations 2001. And this ultimately, Veterinary Medicines Regulations 2013, and the misuse ultimately determines what we must do in relation to acquiring medications, especially controlled drugs, how they must be stored so to remain safe and effective, how they must be prescribed, who prescribes them, and how they must be supplied. And they must be under specific premises, veterinary practice premises, and to be considered a legal and viable veterinary practice premises, you must be given the okay by the Veterinary Medicines Directorate, or potentially, of course, the Royal College may do that, as I said earlier, on behalf of the VMD. There are 4 classes of veterinary medicine. There's POMVs, which is ultimately prescription-only medicines, and the only people that can decide to use that drug is a veterinary surgeon. Then there's the POMVPS, so that can be somebody that can, so a vet can prescribe it, a pharmacist can prescribe it, or a suitably qualified person, so an SQP, can acquire and supply those. NFA stands for non-food animal, so pets, and that can be supplied by a vet, a pharmacist, or an SQP. And then you've got your AVM GSL, so general sales list medications, and they're the ones that you can buy, for example, in pet shops or supermarkets, and that actually they're on the shelves, you can pick them up, and no one has to give you any guidance in relation to using them. But a lot of pet shops and tack or equine sort of tack shops, or whatever you call them, that they can supply medications now if they employ an SQP. Okay, veterinary nurses are not automatically SQPs because of how the different legislation that controls that, but they are given credit for their veterinary nursing education, and therefore they can do a relatively easy conversion course to become an SQP. But anybody can become an SQP if they take the course. So in relation to supplying medicines, there's really 2 levels. You either prescribe or dispense, and it's important to be clear of the distinction between those 2. So prescribing means the act of deciding whether a medicine is appropriate and which medicine is appropriate. And that's, for example, the POM's prescription-only medicine, someone who's qualified to actually say, that's the medicine I want to use. And then dispensing is about actually handing that medicine over to the owner or giving it. And the law says, in the Veterinary Medicines Regulations, sorry, it's 2013, it's not 11, that's a typo. The law says that actually the person who actually is handing over, supplying the veterinary medicine, the prescriber must be satisfied that the person handing over it is competent to do so. And that is the only legislation that we have in relation to what specifies whether someone can dispense. Ultimately, it's whether the prescriber thinks that person's competent to do so. So we created a colourful, several years ago now, the Competent Veterinary Dispenser Award, just to give slightly more practical training and advice on that. And that's been a very popular course. We've sold thousands of those courses. Hazardous waste, of course, is relevant to our clinical operations. Ultimately, the law says if you produce more than 200 kilograms of hazardous waste per year, we ultimately therefore have to classify it, dispose of it correctly, and register our premises that is producing that hazardous waste with the environmental agency. And we have to fill in certain paperwork or consignment notes, use the correct codes when we're disposing of it. Basic sort of criteria: we've got domestic waste, which is ultimately the black bags, and those black bags will be sent to landfill. Then there's the blue vials, whereby we have to put in either containers of medicines or, for example, something that's become contaminated with a biological substance. So let's say we've got a syringe with blood in it, and then we've got sharps and needles, scalpels, and glass that could potentially hurt someone, have to be put in yellow. You've got offensive and potentially hazardous. So offensive is your tiger bag. So it's offensive, in other words, it might be poo and horrible, but it's not actually potentially hazardous to man or beast. And then you've got the yellow bag, which is hazardous, especially so it contains potentially infectious, hazardous waste, infectious to potentially other animals. And then you've got the orange bag, which is hazardous in relation to potential people or animals. And that's the most controlled waste type. And therefore, the orange bags cost the most to dispose of. I do see in a lot of practices that I visit, there seems to sometimes just be a general policy of saying, oh, well, let's just put everything in an orange bag. Yeah, fine, that's a very conservative or risk-averse way of doing it, but those orange bags certainly cost an awful lot more than things that don't actually have to be put in those bags. So, but ultimately we have to comply. Ionizing radiations 2017. So if you are doing ionizing radiation, so X-ray, CT, you have to appoint an external radiations protection, an RPA, and they have to come in and inspect us and say, yep, you're set up safely to do this, and they must produce local rules, which means we, the people operating the ionizing radiation within the practice, have to do what we're told by this external advisor. And they also have to appoint a radiation protection supervisor. So an RPS is someone within the organization who has to make sure that these local rules are being applied and adhered to. And they have to be someone who's deemed confident and competent enough to intervene if someone is breaking the rules, the local rules, the regulations, in other words, harming their or others' safety. So the very fact that we have radiation in the building means that we have to comply with this legislation. So we're getting towards the end in relation to the journey. Ultimately, let's look at some of the financial things. The Royal College says when we're creating invoices that we need to give estimates to clients. We should also determine any financial limits, i.e. maximums, before we go over that without any consent. And we need to give itemized estimates as part of our decision or informed consent. Some of the regulations in relation to receiving payment, which we all virtually do. If you are using credit cards, you have to register with the PCI, and that's often initiated by your card provider. Whoever actually does that will send you a little prompt to say you have to go online, fill this in, do the fee, but you have to be registered with a view to collecting money from someone's credit card to do that. It's often forgotten about, but it's prompted, as I say, usually by the card provider. If you're collecting payments indirectly, so a direct debit, so just the difference between direct credit and direct debit. Direct credit is your standing order, so the customer pushes money towards you, whereas a direct debit is you're pulling money from the other person's bank account, which means you can change the amount that you're pulling from. Of course, you have to advise them if your healthcare plan is going to go up in price. You have to say, by the way, on the 1st of January, we're going to increase our prices by whatever you increased, and your direct debit will change. You don't have to do anything, customer, but just so you know. Okay. And you can only collect direct debits if you are what's known as a direct debit originator. So unless you go through that process with the financial conduct authorities to become qualified to collect direct debits, we can't do it ourselves. You could ask your customers to set up a standing order, but you as the company don't have control over changing that. And then in relation to the final part of the journey, we said, when will I see you again? Well, of course, then that becomes data GDPR once again in relation to how we use someone's data if we are going to contact them. So there's considered 3 levels in relation to the consent to contact someone. You can contact them about general information, which is, hi, just to let you know, our practice will be closed for these dates over Christmas. So you're not trying to sell anything. You're just basically saying, we have a relationship with you as a registered client, and we think you would probably want to know when we're open and when we're not open, but we're not trying to actually sell something. Then you can have a reminder for a product or a service that they've already consented to. So for example, if they're vaccinating an animal and you assume that you want to have an ongoing up-to-date vaccination, well then they can have the consent in relation to that level to say, are you happy that we send you reminders for this product or service that you've already had from us? And then the 3rd level of promotion is, here's a new thing, you've never had it before, you might be interested in it, which is starting to get into the sales territory. So we need to think about what levels of consent we're actually asking people within our GDPR consent forms. Usually this is assumed. This first one is definitely assumed. The second one, most people will, shall we say, be mildly presumptuous and assume that if you've had the product, you'll want to remind it of it. Whereas in this one would be considered going to promote things cold to people would be probably considered a breach of GDPR, unless people explicitly say, knock yourself out, send us whatever information about whatever products you want. And the other thing we have to ask them is, what's your preferred means of being contacted? Do you want to post, text, email? And that might relate to certain services like iRecall, which is probably one of the most popular in the profession with a view to how we actually contact people. And that's ultimately it. We've got this sort of little diagram that I built in the beginning, and I've used various levels of regulation and how they relate to personnel, premises, and equipment. And I suppose the final one in relation to the organization is if you have a limited company as opposed to a partnership or a sole trader organization. If you're limited, registered with Companies House, which is the department that registers all companies in the UK, is you have to comply with the Companies Act 2006, which means you must submit financial statements. And there's 3 financial statements: your profit and loss, i.e. how much income you've had, how much cost you've had, and therefore what your profit is. So that's publicly available information. I could go and look at any limited company's profit and loss sheet. The balance sheet is a legal obligation where you must say, this is what we borrowed and this is what we bought, if you like, in relation to equipment or assets, fixed assets. And this is what we own and this is who we owe. Not necessarily who in specific terms, but actually the amount of debt or the amount of equity. And CFS stands for cash flow statement. And this became, whenever various financial shenanigans going on or frauds back over history, where money was being taken out of pots like pension pots, and employees were being drained of their pension, but nobody knew that the executives were doing this. So they brought in the cash flow statement to show exactly where money was coming in and out of the organization, with the idea of making sure the company remains solvent. That's why that's considered there. Just a final reminder about some of the courses that we talk about. As I say, all of these regulations, but much, much more in an operational, practical sense, are covered in our Certificate of Veterinary Practice Management, and the discount still applies. So, bit of a rattle through in about an hour in relation to more than 10 laws, and I'm happy to take any questions.
That was brilliant, Brian. Thank you. I think you did yourself a disservice by setting it up as being dry. It was very interesting. I think I'm sure everyone will agree. It's generated some good questions here. So do you mind if I just kick off with those?
Fire away. Yeah, fire away.
So how do you ensure someone adheres to the off-the-record conversation, not talking about it, and not claim constructive dismissal?
If they sign without prejudice agreement, they have bound themselves. They can't, now obviously you can't stop them. They can go and do whatever they like. They can sign one agreement and do it. But ultimately, they can't go to tribunal and say that actually, look, here's what this person has said. The tribunal will say in any of the correspondence, any correspondence you have, you should put along the top of it, this without prejudice. So it's branded as that. So they can't show it in tribunal and say, actually, look what they said about me.
Right. What are the possible pitfalls of an off-the-record conversation?
Well, it's risk in terms of, you can obviously, if you think you're totally safe and you potentially offend someone, even though it's not necessarily a legally offense, you're not discriminating offense, is you can rile them and they can pretty not have to agree. The big risk of initiating that is that they don't have to agree to the offer in which you're offering them. I mean, if you're ever an employee and you're offered an off-the-record conversation, I would say there's never a reason to refuse that, because it means you don't have to agree with it. But if you're an employer, it actually is a potential to just solve this. And I found that's worked out in my times, but probably 3 or 4 times over my career. We just said, listen, come on, let's just fix this. There's an amount of money you're going to need to make this problem go away. Even though I might go, I don't think you deserve it, but actually, let's not fight about it. It's actually, I've got other things to do, and let's not take the risk of going to tribunal. Other people say, oh, it's the principle, we must go to tribunal, and you want to win, you win, and not, we don't. But anyway. There's the risk is that the employee just doesn't agree. But you're no worse off potentially.
And how can we set standards around conduct and performance, or should what sort of inverted commas good looks like be assumed? It's sort of asking when we're disciplining people,
yeah.
what are the standards we're holding them to? How do we define the standards that we're holding them to? Or is it just inferred or assumed?
Well, no, it's a very good question. Often people sort of say, well, you never told me that. Now, this is getting beyond the law. There's no law that says you have to be sweet and send somebody everyone a birthday card. Unless you put it in your contract and said that's what you're going to do, then that becomes contractually obliging. That doesn't make it a criminal act. It might make it a civil act. So a criminal act is that you breach the law of the land and the police can come and register you. A civil act is you and me had agreement, Ryan. We had a contract that said that you would sing to me every morning, and actually you didn't turn up on Wednesday, and it says in the contract you were going to do that. I'm going to sue you because I've been so hurt by you not doing that, and therefore I will sue you for an amount of money. So if you have something contractual, you have to oblige it. But in terms of the question is actually much more about managing expectations and discipline, and that's a whole other talk, to be honest. How do you actually have the one quick piece of advice I would say is, by the time you're getting to a disciplinary and grievance procedure, it's like a salvage procedure. Unfortunately, it's a bit like you've gone too far, and many I'm going to say inexperienced managers don't have a quiet word often and early enough. And the best way I've found of having a quiet word, if somebody does something you don't expect, is just to say, okay, I noticed you did A, B, and C. What do I not know? What do I not know? And it's a way of exploring, do you think that's reasonable? Maybe I don't think that's reasonable. Let's clarify expectations. I don't know if that answers the person's question, but there is no law that says you must, that defines the certain behaviors that everybody must comply with. And a lot of it, I mean, we've all probably worked in different practices, and what would be considered banter and a good laugh in one practice would be considered culturally desperately inappropriate in another. So I can't answer that question quickly, other than say that it's not a law. It's often to do with how, I mean, there's certain laws, of course, certain things you can't say no matter where you work, but actually it's about explaining what's appropriate here. And if somebody does something that you deem inappropriate, you have a little word and just go, maybe just here we don't do that.
But then I guess I don't know if you agree with me, I suppose by the time you get to the point of disciplinary, it's not so much a list of good behaviors, it's going to be specific incidents and bad things that they've done that you will bring up with them, you know?
Oh yeah. I mean, to discipline someone, you can't just discipline them to terrorize them. You have to have a reason to arrest someone, shall we say. And it might be a series of repeated, relatively minor misdemeanors, but actually it's got to the point where now it's a problem. Let's say somebody turns up consistently 15 minutes late. It's not like, it's not gross misconduct, but it's annoying to the point where you can say this can't go on. Whereas if somebody, for example, steals money out of the till once, that would be gross misconduct. And you can say, that's enough, we're going to disciplinary. Well, that ends up in dismissal, it's up to you. But often your employee handbook will specify what are considered definitely gross misconduct, but not exclusively gross misconduct. You can say, if you punch a fellow employee, if you tell a client where to go, if you steal, if you turn up drunk, well, I can tell you right now, if these ever happen, that's going to be gross misconduct.
Yeah, brilliant. You've kind of answered this one a little bit already, but I'll just go through it. In order for an off-the-record conversation or, for example, email exchange to qualify as without prejudice, must both parties agree that it is without prejudice? E.g., mid-dispute, someone sends a contentious email headed without prejudice without the other party having agreed this.
No, you must agree. That's the whole point. It's a consensual off-the-record conversation. They don't have to agree. And even, I think, don't quote me, I'm not a lawyer, but I'm just doing this from a manager's perspective, is I think that you have to show that the other person genuinely understands what a without prejudice conversation is. And I had to pay £500 in legal fees for one person to make sure that they were so advised by a solicitor, so they understood what they were getting into.
Yeah. And last question, are there good sites or links you can recommend for guidance on advertising and publicity compliance, especially for coverage of our clinic activities and services online?
So say that again then for me, thanks.
Are there good sites or links you can recommend for guidance on advertising and publicity compliance, especially for coverage of our clinic's activities and services online?
So I'm guessing what someone's asking there is for guidance in relation to, let's say, social media, advertising, and things like that. Well, you mustn't do anything, I'm going to say, illegal or unethical, or potentially offensive as well, even though it may not be illegal. Good sense as well. But I'm going to guess that the BVA has something on that. I have an inkling that the BVA has something on its website about those things. But certainly the Royal College, if you look at the Royal College's Code of Conduct online in relation to, I think it's section 23, advertising, it'll give you a lot of detail in relation to certain things you could and shouldn't do. Now, that's in relation to advertising veterinary services as well as the law of the land. You can't obviously advertise something false. You know, you can't say that you're, I don't know, a rocket science if you're not. That's just illegal. But the Royal College will give you specifics in relation to the veterinary profession.
Brilliant. That was all the questions, I think, unless let me just scroll down, see if there are, oh, there's one more. Is there a time limit between warnings in discipline meetings?
It's a good question. No, to my knowledge, specified specifics. In other words, you could say that I've given you a warning today. How long does that warning remain active for? It's a bit like footballers. When you get a yellow card one season, that yellow card doesn't hold over to next season. And I would say more than a year, you know, would be considered pushing it for kind of make those accumulative 6 months. I would say within 6 months for me would be deemed reasonable. But if you sort of give somebody a warning today and then give them another similar warning and say that therefore justifies dismissal 2 years later, might be a stretch of doing that. I would say, for me, practically, without understanding this, absolutely, it makes sense to me to about every 6 months on this. And remember, a lot of these things aren't defined in law. They're applied by sometimes the discretionary subjective application of these things by people in tribunals. And often that has to be based on precedent, but sometimes just good common sense. I'd say 6 months, more than 6 months, I would say I'd be uncomfortable with that one.
Brilliant. Well, that brings this evening's talk to an end. It's been very educational. Thank you very much, Brian. I think everybody's enjoyed it. Yeah, thank you for everybody for attending, and thank you very much to PetSap for again sponsoring the event and allowing us to sit here and gain this knowledge. So thank you very much.
Thank you all. Have a good evening and have a lovely Christmas in the meantime.
At PetSap, we help you reduce missed calls and save you time by making your client communications more efficient. But we can't achieve that unless we get you where your pet owners are. We do this by providing you with a listing on the PetSap website, providing you a widget on your website, and by providing both web and app versions of PetSap through which your clients can communicate with you. But clients don't even have to download the app with the PetSap's two-way SMS text chat feature. But then we surface all of this in one convenient location for you and your team on the PetSap dashboard and in the PetSap Veterinary Team Member app. This makes it super efficient for you to respond to chat messages via the web, your website, the app, and SMS text in just one location. In the same location, you can collaborate with team members, use template messages, and template media library files. All of this combined will reduce your missed calls by 85% and save the average connect 3 hours every single day while delivering exemplary customer service.
There's no place I'd rather be.